While red tide is always around in low concentrations, we don't notice it until it blooms.
And then when the discolored water comes, the fish kills, the coughing, then you know you have a full-blown red tide going.
The fall and winter is when we typically see red tide in our area. Those with certain medical conditions may be more affected by it.
If you suffer from bad seasonal allergies, or you have severe asthma, or moderate asthma, or COPD, you can find some pretty dramatic respiratory distress as a result of being exposed to that toxin. You may find if you have asthma that you're having to reach for that rescue inhaler a whole lot more often.
You should also avoid stepping on any dead fish to avoid a cut.
Anytime you have dead fish floating in the water, you potentially have bacteria and viruses and other things that claim host to those floating things.
Avoid ingesting any water affected by red tide. Also, make sure any shellfish you eat is tagged and certified by the state to ensure quality. The good news is, red tide is patchy.
So just because there might be bad red tide in one area doesn't mean it's bad everywhere.
Red tide can also affect pets, so it's best to keep them off a beach during a bloom. If you're experiencing persistent symptoms, speak with your doctor, or you can visit one of Lee Health's convenient care walk-in clinics. For Lee Health, I'm Devin Turk.